On behalf of IHMR Bangalore, I, Piyush Kumar, Associate Professor and Associate Dean, Training, and your host for today. Welcome all the respected guests and dignitaries, course participants, and faculty member for the virtual inaugural ceremony of the Executive Program in Digital and Connected Health. It's indeed a great pleasure for me to welcome you all to the inauguration of this course. This evening is special as it brings together experts from various fields who, over the course of the next 4 months, will not only foster new ideas and collaboration, but they will also inspire the next generation of healthcare managers who will be driving the digital health transformation forward. With this, I welcome you all once again. It's a great honor for me to pronounce that today we are joined by Mr. Sameer Mehta, Chief Investment Director, Atlas Family Office, and Vice Chairman, Dr. Mehta's Hospital, as a chief guest of the event. We are grateful for you to accepting the invitation and gracing this occasion, Mr. Mehta. Welcome you once again.
Thank you, Professor Piyush.
Thank you, Mr. Mehta. I feel extremely proud to welcome our special guest, Dr. S.D. Gupta, sir, Trustee Secretary, IIHMR, our teacher, our mentor. Sir, we are deeply honored to welcome you on this occasion and showering us with your blessings. I would also like to welcome our guest of honor, Mr. Nishant Sagar, Deputy Director of Public Health, Confederation of Indian Industries. Thank you, Mr. Nishant, for your gracious presence in this evening on this important occasion for us. Thank you once again. I would like to welcome our guest of honor, Dr. Jai Chakrabarti, COO, PD Hinduja Hospital. Thank you, sir, for your gracious presence today. It's indeed a pleasure for me to welcome our keynote speaker and Professor Sadgopan, visiting distinguished professor of IIHMR Bangalore and former director of IIITV. Sir, we are deeply honored to welcome you on this occasion and showering us with your blessings. It's a matter of pride for me to welcome our distinguished guest, Dr. Vinod Kumar Patro, Dean of Research, AIIMS Bhubaneswar. Thank you for joining us today, sir. This event would have been incomplete without your presence.
Thank you so much.
Thank you, sir. Now, I would like to take pleasure to welcome Dr. Uma Nambiar, Managing Director, Consultant, Bakchi Pathsarathy Hospital, and IISc Medical School, and also Chairperson for Digital Health India Association. Ma'am is an integral part of... Thank you, ma'am. And thank you for being an integral part of IHMR Bangalore and a key driving force behind this course. It's always a pleasure to welcome you, and thank you for your constant innovative support and guidance to us, ma'am. On this auspicious day, I should not miss the special mention to our dear director, ma'am, Dr. Usha Manjunath, who had a vision of imparting digital healthcare education to working professionals so that they can leverage technology and enhance the reach of quality care across the world. So with this vision, we have started this course, and I thank and welcome you once again for joining us today. With this, without even wasting a moment, I would like to invite our director and professor IHMR Bangalore, Dr. Usha Manjunath, to kindly address the gathering. Over to you, ma'am.
Good evening, everyone, and welcome to IHMR Bangalore. And we are very, very happy and proud, to welcome you all for this very special event. So as you all know, IHMR Bangalore, started way back in 2004. And, our legacy of Indian Institute of Health Management Research from Jaipur is way back from 1984. And as you all know that, the main program of hospital management and management programs particularly for healthcare is all the vision of, Dr. Ashok Agarwal, and the institution, kind of grown, handheld, and reached this stature by the vision and hard work of Professor S.D. Gupta, sir. So it's a very special occasion. So very quickly, I welcome all of you. Sam, now I know you by your first name, and it's very nice to kind of have you on board. Mr. Nishant Sagar, Dr. Joy Chakrabarti, Professor Shadgopin sir, Dr. Binod Kumar Patro, and then of course, my dear friend, Dr. Uma, who has been, associated with us, has been a major, cheerleader, as well as a very solid support technically, intellectually in terms of networking. So she has been a great, support for us. Welcome, Uma, and very thankful to you for this program. So just to kind of step back, I'll take about a minute to say, how this whole program of coming into digital health and the space that we are today, is very important to kind of remember. About 2 years back, Dr. Ashok Agarwal sir and Dr. S.D. Gupta sir started saying that, it's time that Bangalore really, starts looking at IT in healthcare, starts looking at a lot more, programs, developments align with, and maybe, with all humility, I want to say this, that what, IHMR Jaipur did for the hospital and health management, professional and capacity building, maybe IHMR Bangalore would be able to really leverage and become one of the leading institutions to come into the digital health space and capacity building and training programs. So, and we're very blessed with their, kind of blessings, as well as their constant support, connecting us to various people. And that brought us, Professor Shadgopin sir, to really mentor us to come to this particular program. And so we have, illustrious people in this whole, development in the last 2 years. And we have started a center called Admire for advancing digital health, management, education, research, and innovation. So we are very happy to, especially this course has been, in the kind of development. It took us quite a bit of time. It took us a lot of people who supported us in this. Dr. Nagendra Swami, Dr. Satish Prasad, Dr. Sham Vasdev Rao, Mr. Praveen of Srivat of Astrasoft, Dr. Sunita Maheshwari, Dr. Dhruv Joshi, Dr. Dilip Raman, Dr. Shashi Bhaskar, the cloud physician. And I think the list can be endless. We have had a lot of inputs, a lot of, programs that, we kind of did, as we were working towards this particular one. And as you all know, we also have, various research projects. That's our key vertical. Our flagship two-year program, PGDM, is very popular now, very well established. Our students are doing very well in terms of placements, in terms of their contributions. Then we also, are in the developing the Center for Admire, as well as moving ahead with a lot of the training and development programs that we are offering. So in this, of course, special, congratulations to Piyush for having made this, possible. And of course, special thanks again to Dr. Uma. And here we are today on a new journey. And of course, it's not, the first part of the first, program like this, which is a full-fledged one, is like a first child. So we have, the beginning, a lot of that, all the students who have joined, all the delegates who have joined will be very special to us. This program, how we also co-learn, all the faculty that have agreed to be with us and support us in this program have been excellent. So we hope to learn, to move ahead, and for establishing this program as a very important and a flagship one further. And I, wish everyone and, the best wishes. And again, once again, welcome to the participants and all the dignitaries who have joined, all the faculty, senior members, experts, industry people. I think it's a very special occasion for us. I'm really, really happy, honored that all of you have joined in this, to make this a big success. Thank you all once again. Back to you, Piyush.
Thank you, ma'am, for your setting the context and for your encouraging words. Now, I think many of us would be a bit curious to know more about the course, how and why the context came in and how it has been developed. So at this point, I would request the course director for Executive Program in Managing Digital and Connected Health, Dr. Uma Nambiar, to kindly address ma'am about the course. Over to you, ma'am.
Thank you.
Yes.
Thank you, Piyush. And a very warm welcome to everybody who's here on the, on the online inaugural session today. And as Dr. Usha has mentioned, that it has been a vision for IIHMR Bangalore to develop a program in capacity building in healthcare and IT. Now, you already know what IHMR has done as a pioneer in the field of health management, and I think this just stems from their motto and their vision to lead whatever is the need for the healthcare industry. They need to step in and continue for capacity building. So just to sort of tell everybody who's present here as to why we decided to do this course and what is it that makes it unique from whatever else is in the industry at the moment. The need to do this course stemmed from a couple of things, and one of them is, of course, my own industry practice, experience of the last 40 years. Involved in healthcare and the implementation, how every organization has gone through many challenges, and it is very difficult for people to adopt to digital technology and understand what is to be done. So the healthcare workforce primarily is not so tech savvy, and in fact, I should. So it's important for us not to be afraid of what technology does to us, and how we have to realize that technology actually improves the way we work and what we do. So that's, of course, the number one reason to get rid of the fear that is in our minds that technology will our jobs. That's what many people think. The second thing that we wanted everyone to understand, that digital technology is just a tool. It's a tool that helps us do our job better. So if we are using computers, how would it enhance the skill at the workplace? How will it enhance the value of your own work? Sorry, I had phone calls that keep coming in the middle, so that was the problem. So how will it enhance, your own contribution to your work and make your job easier and make you perform better? So this is one. Another thing that we have done in this course, one thing that we've done just to make sure that we understand how we can employ or use digital technology better to do this digital transformation in healthcare. Have already used digital tools to enhance the way they work. All of us are very familiar with the way banking industry has really transformed and made our life so easy. The ticketing, hotel industry, fintech, all of them, I mean, are examples of how our digital technology has made so much in our lives. Now, just so that we can so we can relate to what industries are going through. So we have faculty from non-healthcare background and to tell us what we can learn from their transformation journey. Now, anytime we do this kind of a disruptive movement, or it's like an evolution in the industry, we know that we will all be facing challenges, and healthcare industry will also be not an exemption. So we need to understand from telecom, from fintech, from railways, all of these industries, how they managed the challenges, and maybe we can learn and shorten our learning curve. So with that object, we have faculty from multiple sectors. We have people from healthcare industry as well as people from the healthcare technology development partners, as well as other faculty from industries like banking and the telecom industry. This is just to make it easy for us to understand. One of the things that we must realize is that India is poised to become a leader in digital health with the Prime Minister's vision on IIHMR-B Digital Health Mission. This is definitely going to happen, and we all have to play a major role as healthcare industry, as healthcare providers. We have a very significant role to play. So we cannot shy away from it. And the generation that is working in the healthcare industry today we need to equip ourselves with the relevant knowledge. And therefore, the course is designed for people who are on ground. It's very, very practically oriented. It will equip you to really at your job, what do you need to do? At all roles in the healthcare ecosystem, we have the course content designed to ensure that they learn what they have to do at their job. So after you finish this, the fear of digitizing your own organization should not be there. And we will also handhold the participants and the students for the next 1 year to ensure that we continue to help them to solve the challenges which they're facing in their organization. So the faculty will be available for another year for the students of the batch so that they can start their process, and we will continue to handhold them and help them to solve their challenges. That is the way we want to design this, a very practically oriented course. And the idea is that you should be able to immediately get into the mode of transforming your healthcare space. So this is what I needed to say, and I'm sure the participants from this, and a lot of students, I mean, we'll explain when the course actually starts next week, that while the course is happening, the students will also be given an opportunity to be in the panel as a panelist for discussion, so that they are empowered as much as the faculty or the other panelists. So this is an opportunity that is going to be given to select students who actually we identify that can fulfill this role. So there are some of these different things that we are doing for this course, and I hope that you all will enjoy it, and I hope there'll be a learning experience. We expect a very, very robust and very honest feedback so that it'll help us to improve this experience for the students. And I hope that we can become significant players in capacity building in the digital health ecosystem. So thank you very much, and welcome all of you once again.
Thank you, ma'am. So thank you for briefing us about the course. And I think this course is cut above the rest. And it's not just about imparting the knowledge, it's about actually bringing about the change in the industry. Thank you once again, ma'am. Now, going forward, I would like to invite our chief guest for the event, Mr. Sameer Mehta. Mr. Sameer Mehta brings over 2 decades of enterprise leadership, project management, governance, strategy consulting, and entrepreneurial experience with leading organizations like McKinsey, Shell, and Fortune 10 and family business companies, that too spanning across multiple sectors of healthcare, education, energy, chemical, food, technology, and retail across Asia, Europe, Latin, and North America. Thank you, sir, for being here today. Over to you, sir. I would request if you could kindly address the gathering and declare open the course.
Thank you, Professor Piyush, and thank you, Usha and Uma. One's a very dear friend of mine, and one is going to be a good friend of mine, is the way we will frame it, but it's great, and it's a little bit of a privilege for me to open this, because I think this is the need of the hour. I think, as Uma rightfully said, this is a tough problem, but a much needed and global problem. This is an industry with less than 10% digital application, meaning that only 10% in the recent Gartner reports, in the previous Gartner reports, we're at 7 to 8%, versus something like banking, which is closer to about 80+%. And even the pharmaceutical industry is further ahead of us. So first of all, I think the need and pain that is felt at different levels, whether you're a consumer, whether you're an internal customer, doctors, nurses, whether you're an administration staff, the capability of making life better tomorrow than it was yesterday for this group is distinctly high. So one, there is a serious pain. The second is that whatever India solves, as Uma said, is probably likely to be a solution for the rest of the world. Why? Because the typical Indian solutions tend to be quite strong in precision, fair in quality, and more importantly, of high value. So if you think about where most of the world's population resides, we're not solving first world problems with first world prices. We're solving first world problems and developing world problems with developing world prices, right? So the opportunity, and that's why the SaaS ecosystem has been such a huge success from India to the global world. That's why the ITES platform has been such a huge success. All these Fortune 100 companies from India are based on a backbone of providing high value services to many parts of the world, including into the first world as they think of themselves countries. The irony is most of the first world countries, and I've spent a fair bit of time, 21 years in some of them, actually are living with what I would call fourth world problems. The health system of the NHS, for all people saying it's wonderful, is very average. The first world system of America and Medicare is very average. If you have a doubt about that, just look at the patient safety numbers of how many patients die because of mistakes and how many of those mistakes have a technology component to it. It's an extremely high number. You look at insurance satisfaction in the West from some of these most developed nations that talk a lot about their success in healthcare, very average, right? So if you're asking us, is this a real problem? Is this a local problem? I'll say it's a huge global problem. And it's one that unfortunately is not easy to solve, because you have to understand the customer well. You have to work with very different groups. For example, for you to impress a customer, which is downstream a consumer, you have to impress a hospital owner to implement a technology. You have to work with doctors and nurses and impress upon them to use the technology. And typically you have to find enablement mechanisms that succeed. There are examples of success. So it's not that there aren't. We have an investment company. We have actually 3 in our portfolio that are hugely successful. Keto, most of you will be familiar with it. They do the crowdfunding for people who can't afford. That has been one of our biggest success investments that we've had. The second one is a company called Health Sensei, which does connected health. They act as middleware, connecting a lot of wearables, machines in hospitals, machines at homes with infrastructure. So hospitals and anyone who is a concentrated customer, they don't work directly with consumers. They have been quite successful. And the third is a company called iBar, which started working with organizations like Kaho and AHPI, which I would also recommend many of you play a role with, because we have some great events coming along. And there are many that Uma has been involved with as well, like the Digital Health Mission of India and FHIR and HIMSS, that I think you will find that there are many groups trying to help you, whether it's the Ayushman program, the NDHM, whether it's the NASCOM group, whether it's the CII, FICCI, ASOCHEM, you name whoever it is, all want to help you. The reality is we're struggling to find the right solution at the right price. We're struggling to find a solution that works for all the stakeholders in the ecosystem, not just the customer. You can have a very nice app And let's be honest, this is the most expensive real estate on planet Earth. And if you have a doubt about that, each app on your front screen of your phone is probably worth over $1 billion. And no real estate in the world is worth over $1 billion. Yet it will happen. But by then, this will probably be worth $10 billion. So the reality is the opportunity to be a technology success in healthcare is huge. There have been many examples of people who've tried. Some are still trying. Many have failed on the wayside. So I think the opportunity to solve this problem is high. I think if you're able to marry this, and I really was impressed with hearing what I heard, which was what Uma had said, that you're going to have faculty available for a year after the program. I think that will make the world of difference, because this is not an easy problem to solve. And if you can enable these warriors, I use a bad term from the medieval times and the Saxony world, which is the knights in shining armor. If we can have these knights in shining armor, which is you, the student, come and play a role, whether in a hospital environment, whether it's in an industry we help create, the home healthcare industry, whether it's things like the laboratory space, whether it's a pharmaceutical player or an insurance player, you will see the difference. And I will tell you, the opportunity is huge. We invested in a company about 1.5 years ago in insurance tech for healthcare, Vitreya Technologies. And that's one of the fastest growing companies and what they call the Sunicons in India. In health, they're only doing health insurance. We invested in a health publication company called Dialogue. The name of the company is something slightly different, but they put this Dialogue magazine out there every month, and they do special issues. And I think many of you, like Professor Usha, Dr. Uma, have all been featured in it multiple times. I think you'll see that the opportunity and the capacity to play an innovative role in healthcare in the digital space is huge, right? This is a $200+ billion industry just in India. If you go globally, healthcare is pretty much the #1 industry in most places. And I think if you can make that work for you as a successful implementer of technologies, you will be thanked. The second thing is, as the world of AI and the world of machine learning comes into play in a bigger method, you will not only be on the front lines of things like connected health, but you will also be one of the people who will be at an advantage versus most of your peers, whether you're a nurse, whether you're a doctor, whether you're an administrator, or whether you are just interested in healthcare. The capacity to play a key role in this industry is huge. And I will end with a very simple statistic. There are 80,000+ hospitals in India. Less than 3,000 have heads of IT, less than 500 have CTOs, which means that the job of a lifetime, whether it's a CIO, which is a chief information officer, whether it's the head of IT, or whether it's that golden grail of CTO, I think those are all open for opportunities. And more importantly, I think the future CEOs of healthcare organizations and systems will all have deep digital expertise. So with that, I wish the course and the participants a great time. I wish the professors a great opportunity to teach and share wisdom with us. And more importantly, people like me do invite us so we can learn from some of you smarter folks out there, because I think this is a serious problem that needs serious people to now give it serious time to make a difference. I think if we can do that, tomorrow will be better than yesterday. Thank you.
Thank you, Mr. Mehta. That was really interesting to know. And thank you for highlighting the immense potential which we are sitting upon. The last word, the golden words, I would say, so gives us another level of confidence that our participants and we are on the right track. Thank you, Mr. Sam. Now I would like to invite our guest with an extensive experience in public health, policy strategizing, designing large-scale implementation processes, leading a multi-sectorial coalition, implementing public health, supervising multidisciplinary team. He's also through ABPMJ, health services provider in the country. With this, over to you, Mr. Nishan. I request you to kindly say a few words for our participants and for our gathering.
Thank you, Dr. Pius. And it's a really honor for me to present here today in this inaugural function. And I would like to congratulate the IHMR team for designing this executive program on digital health subject. And extend my warm greetings to Dr. S.D. Gupta sir, Professor Manjunath, Mr. Mehta, Dr. Uman Ambyar, and all distinguished guests and faculty students. So it's really it's like very crucial time in for the healthcare industry, and today India is on the brink of a healthcare sector revolution. The government wants no compromise on the health of citizens, universal health for all, immunization for all, a disease-free India, and the global standards of excellence in healthcare. Digital health now has emerged as a crucial component for the public health perspective, for the global perspective, for the One Health perspective, or whatever you want to say, offering innovative solutions and like digit surveillance, monitoring and evaluation, diagnosis, treatment, EICU, whatever you want to talk about, you can talk in the perspective of the digital health. Digital health technologies, wearables are there, mobile health, EICU solutions, electronic health records, everything is in the place. Now everyone is talking about these solutions only. And in developing countries like India, digital health is like very crucial to, because the population load is very high. We are now like reaching 140 millions of the population, and the shortage of healthcare professional and the limited resources. Number of medical seats are limited, number of super specialization seats are limited, and government wants to amplify the potential of digital health. Now India has made a significant changes, like the Dr. Nambiar also said, the ABDM is in the place, Ayushman Bharat Digital Health Mission, which aims to create an ecosystem. It's not a platform, it's like they are creating the ecosystem for the all. It's like the public hospital or the private hospital or for the clinic. So this type of system, government is thinking about this type of systems in India. So why not to leverage such type of system? So however, everything is in place, but still there is a challenge for like awareness, infrastructure constraints, like Mr. Mehta said, like how many CTOs are working, it's like less than 1% or 2% in the India. So there are lots of challenge in the terms of awareness, infrastructure, and also the technical specialties. But the potential benefits of digital technologies are abundant across all care sector of settings. So hence all healthcare workers, health professionals, clinicians will be expanded to digital tools, offering information, automated decision support, and definitely the new technologies engaging with patients as well as the collaborating with the other workers across the system. How to exchange data, how to exchange information. It's not only the hospital to hospital. We can think about the global perspective also. Recently, I was part of the one of the G20 meetings held in Goa. So that was based on the digital technology also, technology solutions only. So I heard lots of speakers from the overseas speakers, someone from the Saudi Arabia, someone from the United States, UK, everywhere. Everyone is talking about the same thing, how to exchange the data. So professionally trained professional is required now in India to manage all the tech services, exchange of data. There are different components. It's not only about the first line user of the technology. It's also about how you are handling the data, so security issue, privacy issue. There are many things. So such type of course today you are inaugurating is very crucial, and it's like really the need of this time to how to manage this the overall platform of the digital health. So, and definitely digital transformation in the health sector is not a simple thing, because it's not only about the technology. You need the human attitude also to change your mindset, to transform the things. It's not about the traditional things. So definitely health professional could be relieved from the time consuming things. They can use technology to enhance their capacity, delivery quality services and everything. And many health professionals already use some of the digital technologies apps, as there are many apps available on the Play Store or Google app or whatever. But are they aware how to use these apps and what is the potential benefit they can take from these apps? So such type of course is very crucial to teach them how to innovate the things, how to implement things. So definitely, however, healthcare professionals often reports not having opportunity for the upskilling required to put the technology full use, but also the legal, financial, and organizational aspect to work, design the protocols, adequately reform the enable the technology to add value in the services, delivery of the services, and it's for the three pillars: promotive, preventive, curative. For every pillar, you can think about the digital health implementation. And now the government of India is thinking about the implementation of digital tools and technology at the primary level, at the health and wellness center level, telemedicine things. So in coming decade, India has the ability not only to close the skill gaps among the domestic health force, health professionals, clinicians, but also become a global exporter of healthcare professional to the world. To do this, the private and public sectors must collaborate together, innovate, and should be solution oriented. So definitely human expertise and skills need to be advanced and enable the digital technology to add values, including digital skills, merging of high tech and high touch solutions, high touch skills, and definitely create a larger cadre of individuals, professionals with hybrid skill of mix with the physical things and the virtual world, digital technologies things. And definitely the launch of such type of course would be crucial for the future. And the last, just I would like to say, future of health is digital only. Thank you. Thanks a lot.
Thank you, Mr. Nishant. Thank you very much for highlighting the importance of digital upskilling. And it's not even for only for the private healthcare professionals, it's for the public health professionals, for the management, clinician, nurses, technicians. Everyone has to get upskill on the digital health. Thank you, Mr. Nishant. Going forward, our guest of honor, Dr. Joy Chakrabarti, and our keynote speaker, Professor Sadgopan, has not been able to join today due to some urgent commitments, and they have conveyed their best wishes. Now, I would request our Trustee Secretary, sir, Dr. S.D. Gupta, to kindly address the gathering, sir. Over to you now.
Thank you, Piyush.
Thank you, sir.
Let me at the outset congratulate you and Uma Nambiar. Finally, you could put together this very important initiative of scaling healthcare professionals and IT professionals in digital technology or digital health. This is a very, very important and a novel initiative, I must say. I've been telling you all who comes first in the market, rules the market, leads the market. So in the education sector, in the training sector, this was very much desirable that IIHMR Bangalore should have started this program. We are very much right in time to start it, because the need of the time today as well future in healthcare is dependent on digital technology and how much we can take it and how much we can prepare people to accept this and practice it is so important. You know, we have very important goals to achieve in healthcare globally and also in India, this universal health coverage. So whenever I talk about digital health, I do not talk about the organizations only that provide healthcare, whether these are hospitals or primary healthcare institutions or providers of healthcare. But I think we need to really see the other side, the users of healthcare, for whom all this is developed. Ultimately, what we want to achieve, we want to improve standards of health. And this is the mission with which we started in 1984. Now, this is the time we should think about how we make our organizations, healthcare organizations, more effective and efficient. And one of the way the technology has provided us is this digital health technology. I was listening to Mr. Samir Mehta, how banks, how pharma industry, how even media, you are watching your TV and you want some channel, within seconds, you can get the channel. You have to just send a missed call, and in next moment you have that channel or your own television. All this is, how efficient they are. And someday we should see healthcare organizations are so efficient in reaching out people with diagnostic facilities, with treatment facilities, and also information systems. One of the things that has severely affected quality of care anywhere in the world, and particularly in the developed world and in our settings, the communication with the users of healthcare is very, very poor. They don't have information. And this is one reason for dissatisfaction or frustration with healthcare today. I think this digital health technology should help to provide more information to the users in a better way, in a faster way, and in a very comprehensive way. So ultimate beneficiary is the user of care, because we aim at improving their health and wellness. Of course, the wellness of the hospitals and health institutions is also very important, but we all are for wellness and health of the people. And now we face greater challenge, at least formally now, that India is the most populous country. The big debate among we professionals is a boon or a curse to have a larger population or largest population. I think the positive side we need to really look at. And the time is to build skills in new areas, new initiatives. We need more entrepreneurs. And it is not only the business part. They do not search for the job, but they become job givers. I think that should be one of the solutions that we need to have. So without taking much of the time, I must congratulate Piyush and Umaji, and also Ushaji for leading this and making this happen tonight. And I'm very much impressed and very welcome Mr. Samir Mehta and Nishant. They really, so Nishant discussed with us where we can go. And Mehta ji told us the business possibilities. Those who are participating in this program, I think they should be benefited from technical point of view and from business point of view. And what we are doing in this course, I believe this should help all the participants. So my all best wishes to the participants. You will be the first to get the formal course on digital health and connected health, what we are talking. What we learn from in this short-term course, this executive program, will help us to develop full-fledged master's program in digital and connected health. We are aiming at developing a full-fledged postgraduate MBA program in digital health management. So what we are doing in this program is we are testing ourselves. And while we run this course, we learn many new things in collaboration with many stakeholders, our friends like Sadgopan, Samir Mehta, or Joy Mukherjee, or Nishant. I think this is the learning time, and Bangalore is a place where most of the startups and innovators are located. I think we have to really make this program more, I think more and more people should look for such programs in a city like Bangalore, where most of one is this is IT hub, second is also a startup hub. So I think this is the right place. So this is right time and right place and right people who are doing it. I'm sure the participants of this program will be really benefited. And for us, it's a learning opportunity. We would put someday a full-fledged MBA program in digital health management in the coming time, but the knowledge at this point of time, probably we are not aware it's available, but we need to access that and design the program accordingly. So look forward to learn from you all. And I also believe you will learn from this, and that should be help in your professional career in coming time. So thank you very much for joining us, and thank you all the distinguished guests who spoke in this inaugural session. And I'm really very excited that this finally started. As I said, this is the right time, right place when it has been started by right institutions. So leverage upon our legacy, and we can definitely make a difference. We have made difference in healthcare. We can make difference and add value to healthcare by pushing through digital health technologies in healthcare. So thank you very much for inviting me. And thank you all who are participating, who bothered late night to join this inaugural program. Thank you so much.
Thank you, sir, for keeping your faith in us and constantly inspiring us to take new initiatives. As you touched upon the implication of technologies in other sector. So in this course, we have built up the cross-functional knowledge. There will be people coming from different industries like banking and talking about the integration of technology so that healthcare can learn and adopt from it. Thank you, sir.
Thank you.
Yeah. So going forward, I would like to invite our distinguished guest, Dr. Binod Kumar Patra. Dr. Binod Kumar Patra is Dean Research at AIIMS Bhubaneswar, Chronic Disease Prevention and Control. Sir has been awarded with Bursary Award for International Epidemiological Association and Evidence-Based Medicine from ICMR. Sir is also a fellow from International Medical Sciences Academy, Fellowship of Indian Public Health Association, Fellowship Public Health Leadership and Implementation Academy for NCD, Emory University, USA. With this, I would like to request Dr. Binod to kindly enlighten us with his words of wisdom. Over to you, sir.
Thank you, Pius. Good evening, Sam, Usha, Dr. Uma, and Dr. S.D. Gupta, sir. And I'm privileged, and Nishant, of course. I'm privileged to be a part of this inaugural function of this interesting course, that is Managing Digital and Connected Health. I was happy with the nomenclature of the course, because when we say digital, the connection is disconnected world. You connect through digital technology, and most of our old time physicians, surgeons, they will say medicine is something where empathy is there, connection is there, and there is a human touch with medicine, which go hand in hand. So that has been kept in the nomenclature of the course. Though it is digital, but it is connected world and connected health. So that's something very important. We are not disconnected. We are going to be more connected. The second part of my second point would be health system is the most resource intensive system in the world and most complex system. I see many physicians here, neurosurgery, gastroenterology, whatever system you say, respiratory system. Most complex system in the world is healthcare delivery system. And to solve the problems of healthcare delivery system, we need to think out of the box. The challenge is the conventional thinking, conventional paradigm has not solved the connected and unconnected or not connected. We have people who have nots. There are initiatives in public sector, private sector, and voluntary sector who have taken their conventional wisdom to reach out to people through conventional solutions. However, still the access of healthcare is not to the reach of many in the country. So what Ayushman Bharat Digital Mission, the Prime Minister has envisaged that digital mission will be the forefront for reaching the last mile connectivity. Last mile connectivity has to be every health and wellness center now operates through something called e-Sanjeevani platform, which is doing wonders in the public healthcare delivery system. The challenges in digital healthcare delivery system is also there. We need to be careful. We need to be cautious. We need to take baby steps to go for a full-blown revolution, digital health revolution. The current security attack for All India Institute of Medical Sciences, New Delhi, has opened many questions. How secure is our digital platform? Of course, we are the world leaders in digital technology. Things will be there, and as Sam told, that any new change will have resistance from the old group of people who will be exposed to the new transformation. So any transformation will have resistance from the system, within the system. We need to face them, address them authoritatively and with patience, I would say. I bring in greetings from my institute and from my academia background, that this executive program, as Dr. S.D. Gupta has mentioned, this is an executive program where people from different background will be training, and different background has been enrolled also. So they will be fitting to the roles what Sam has already mentioned. In the hospitals, there are information officer and whatever consultants and digital health experts, they will be placed. Yesterday, there was a placement at AIIMS Delhi, Chief Information Security Officer. So that's something which is new for me, Chief Information Security Officer. And this is again a physician with a digital technology, who is passionate about digital technology, digital health solutions, and who can take care. The second part of, third part of my talk would be, if you look at the health system building block, there are 6 building blocks which World Health Organization has been talking about, addressing 6 building blocks, so that we have an efficient healthcare delivery system, and also we have an equitable healthcare delivery system and a viable healthcare delivery system. One of the building blocks predominantly talks about information system, health management information system and information system, which is the live wire of health system building blocks, which connects all other 5 blocks. Eventually, finances, healthcare technology, resources, drugs and technology, human resources, all have to be connected, and it has to be threaded with a live information system. The success of digital health solutions like mobile health solutions, app-based solutions, and full-fledged digital solutions, digital hospitals, as somebody has already talked about, e-ICUs, e-mobile care, electronic care provision, electronic prevention programs, and electronic rehabilitation. Palliative care is also being phased through electronic modes. So the scope is immense. I am not an expert on that, but what I would say is we need to catch both ends of the life cycle. We need to have executive programs. We need to catch younger graduates who are into medicine, alternate systems of medicine, who can do wonders. We need to catch them as well through sensitization, through we can have a bridge program, or we can think in those directions, so that the new generation physicians are not trained with the old thoughts. They have to be trained with the new dimension of which is evolving, which is emerging, and I'm sure they will be secure, they will be validated, and they will be foolproof, so that young minds are also being trained on this. I congratulate all participants of the course, all faculty of the course, for getting new flavor into the healthcare education platform. And I'm sure there will be many takers for this course. And I wish all the success to Piyush, Dr. Usha, and all faculty of IIHMR Bangalore. Thank you.
Thank you, sir, for encouraging us by complimenting the title as well, and also for bringing out the essence of digital healthcare and its implementation. So I would also like to thank at this juncture Dr. C.S. Kedar, retired IAS and also senior advisor for IIHMR Bangalore. He has been actively supporting us on many initiatives and constantly engaging us with the private and public healthcare partners. on the many initiatives like in the symposiums in the Bhubaneswar, also supporting on development of the Admire as a platform. Somehow, as he is traveling, so he was not able to join today, but his blessings are always with us. Before we wind up, I would request if any faculty member would like to say any few words to the participants and to the entire, maybe Mr. Saurabh Gupta, Mr. Avinash, any faculty member, I request kindly to come forward and speak few words.
Good evening, Piyush. This is Anantapad Braban.
Good evening, sir.
I've been coming to IHMR for quite some time. I've been a faculty, and I'm also getting a lot of interns into hospitals and training them. And, I've been in the IT space for a very, very long time. And I really congratulate IHMR for bringing up this very, very novel program, very useful program. And I think we have very, very few trained IT professionals. So I'm sure this program will really reach its heights. And as Professor Gupta said, I think you should really venture upon a 2-year full-time MBA program in healthcare IT. I wish you all the very best, and I'm proud and honored to be a part of the faculty in this program. Congratulations again.
Thank you, sir. We definitely look forward for a 2-year full-time program in digital health. I request any other faculty if wanted to have a few words.
Hi, good evening, everyone. This is Avinash. I'm excited to be part of this program. I welcome you all to be part of this program. It's exciting to be part of this journey now that IHMR is starting and setting a milestone here and starting on a new journey here. It's a brand new program. Obviously, India is on a journey to lead in the digital space anyways, and by entering this is perfectly the right time for you to take advantage of this program, and I look forward to being part of this learning as well as sharing the knowledge that I have gained so far in the digital space.
Thank you, Mr. Avinash. We definitely look forward for a lot of learnings in this session. I think all the participants are also excited. Thank you. So considering the paucity of time, and since we are already there by 9:30, I would just like to take an opportunity before we do the vote of thanks I request everyone to kindly enable their camera so that we can have one group picture. So if we all can enable our cameras, Andrew, can you help us take the picture?
Yes, sir. Yes. Yes, sir. It's done, sir. Thank you all.
Thank you, everyone. I think Mr. Saurabh is also here. Saurabh, sir, you want to just say a few words before we wind up? So you're on mute.
Yeah, sorry. So I think with the time already clocking 9:30, I would just like to say I am excited to be part of this group, and I look forward to share my learnings over the last 20 years, especially last 3-4 years. I have been experimenting with digital health, including digital marketing, and there are a lot of learning then in the webinar last week. I said that there are a lot of learnings from other industries which we need to learn. So I look forward to discussing and even learning from the participants what are some of the key things healthcare can learn from other industries, because we are not the early starters, we are actually quite late. So with this, all the very best, and I look forward to seeing majority of you in the first class with Avinash.
Thank you, sir. With this, I would request Mr. NG to kindly deliver the vote of thanks.
So we would like to thank our chief guest, Mr. Samir Mehta, our distinguished guests of honor, Dr. Vinod Patra, then Mr. Nishan, and K.S. Kedar sir, Dr. S.D. Gupta, Dr. Usha Manjunath, and Dr. Uma Nambiar. So this is a platform wherein we all would like to learn and collaborate, and like the speakers who had spoken, utilize digital technologies so that we could reach out to everyone in the healthcare system and reach out with a human touch. So I would take this opportunity to thank our faculty members, our participants, our well-wishers, and everybody who's involved in this course and who we would be reaching out through this program. Thank you very much.
Thank you, everyone.
Yeah,
Yes.
thank you.
Also, we would like to thank Piyush sir, who did the emceeing of the program as well.
Thank you.
Yeah,
Thank
he's
you all.
the Sutradhara of the program too. So thank
My
you.
pleasure, ma'am,
Yes.
for your guidance.
Yes.
So the classes will commence from the.
Congratulations.
Thank you,
Yes.
ma'am. All the participants, the classes will commence from next Wednesday. We will be communicating the schedule and other details with you shortly. So we look forward to see all the participants for the classes and sessions now.
All right.
Thank
Thank
you
you
all.
all.
Thank you.
Best
Thank
wishes.
you, everyone, for
Bye-bye.
joining. Thank
Thank
you.
you.
Bye-bye.
Thank you, ma'am.